Hello, my name is Jeremy Rogge, and this is my medication administration demo. First, I'm going to show you the med cards, front, back, that's for warfarin, and ibuprofen, front, back, and warfarin, front, back. Fantastic. So first thing we're going to do is compare the MAR to the physician's order sheet. We're doing this by comparing the names, Mr. Yen, they're correct. The date, July 10th, birthday, July 10th, 1956, yes, correct. FIN number 123456789, it's the same on both sheets. And the doctor is Dr. Sanders, that is confirmed on both sheets. Next, we're going to check the correct, we're going to check the medication. So ibuprofen, they match up, right drug. We're checking the medication right, so right drug, right route. So right dose, 200 milligrams, that's correct on both. Right route, it's PO, that's on both as well, that's oral. And then right time, yeah, we have the same time on both at supper time, 5 o'clock. So then we go to the next one, acetaminophen. Acetaminophen is correct on both. Right drug, right dose, 500 milligrams, that's the same on both. Liquid suspension, it's the same on both. It's going to be taken orally. It's the same on both. Right time / frequency, that is the same on both. It is 4 times a day on both sheets. So then, next one, we're going to go to warfarin. Right drug is the same one. Warfarin is on both. 2 milligrams is the same dose on both sheets as well. And it's being taken orally, so right route, it's the same on both. Right time / frequency, 5 o'clock. Times 4 days. Times 4 days. Yes, that's the same on both as well. Alright, so now that we checked the order sheet and the MAR, we are now going to create our drugs, get them ready. So to do that, we take a tray, get everything that we're going to need. We're going to need a syringe to get the liquid suspension of the acetaminophen. We take the acetaminophen, we take the ibuprofen, and we take the warfarin. We're not done there though. We need to compare the container to the MAR. So, we'll start with acetaminophen. Acetaminophen, right drug. We need 500 milligrams, so we're going to take 10 milliliters of this liquid suspension to get 500 milligrams of acetaminophen. We're going to check for the expiry date on here. We're just going to check for the expiry date. Okay, what else do we check? Yeah, okay. So then ibuprofen. Ibuprofen, 200 milligrams, that's correct. Same drug, same dose. We checked for the expiry date as well, and we found it. Okay, and next, warfarin. Warfarin, yes, it's the same drug. Now we need 2 milligrams of it, so we're going to take 2 tablets because 1 tablet is 1 milligram. We also check for expiry date, and we are good on that front. Fantastic. So before we create the drugs as well, we're just going to go over their side effects, nursing implications, and the onset of the drug. So for ibuprofen, this is an anti-inflammatory. It's used for osteoarthritis, fever, and inflammatory disorders of any kind. The safe range is 200 to 400 milligrams. So this dose that we're giving is very safe. Some side effects we can find: nausea, peripheral edema, and headaches, maybe tachycardia as well. So what do we need to keep aware of? We need to keep aware of GI bleeding, of course. That's common in all NSAIDs. All right, so next one, warfarin. It's an anticoagulant. So the major side effect that we're going to look for is bleeding. You can find that in the stool. You can find that anywhere. So doses is 2 to 5 milligrams. So the dose that we're giving of 2 milligrams is safe within that range. What does it do? It stops blood clotting. So it's used for preventing myocardial infarctions, heart attacks, strokes, things of that nature. What are some side effects? Once again, it's the bleeding thing. We gotta watch for that. There are some considerations. We just got to check their liquid level. Okay, acetaminophen, last one. It's also known as Tylenol. What does this do? It's an analgesic, so it's a pain reliever. It also can be used as an inflammatory drug. So the dose is 325 to 1,000 milligrams for one dose. You cannot go above the 1,000, otherwise you enter into toxicity. Toxicity is a major thing with acetaminophen. We have to make sure we're not going above too high of a dose, otherwise, the liver's not going to like it. Some side effects, nausea. Once again, the toxicity is a major problem. There are some considerations. Got to make sure that there's no drug interactions. Make sure that they're not taking an acetaminophen before we administer. Otherwise, once again, we might get some liver poisoning. Anyways, now we've gone over that. Let's get the drugs ready. To do that, we're gonna get the labels out. We have 3 labels because we have 3 drugs. So, put one back. So we're gonna do ibuprofen first. To do that, once again, we are going to need only 1 tablet, using 200 milligrams, put into the cap, and we have that one ready. We create the label. So first we put the patient's name on there. Miss Day Yen. Drug name is ibuprofen. The dose is 200 milligrams. That's 1 tablet. That's the volume. Concentration per milliliter. That doesn't work. But we could say the concentration is 200 milligrams per tablet. The date is December 16th, and it is now around 16:50. Let's say that. Signature, it's mine, UMSN. All right. So now that we've created that label, put it right on there. Boom. Ibuprofen's done. Next, do warfarin. Now, because warfarin is a 2 milligram dose, we're going to need 2 tablets. So we put it into the cap. Get this guy ready. And we put it into there. Immediately, we create the label for it. So, once again, Miss Day Yen is the patient. The drug name is warfarin. The dose is 2 milligrams. Volume is 2 tablets. Concentration is 1 milligram per tablet. Date time, once again, December 16th. It is now 16:51. Signature, that's for me. UMSN2. All right. And we put it right onto the medication cup. Lastly, we do acetaminophen. So of course, because it's a liquid suspension, we're going to pour into here first. And suck up above 10 milliliters. Okay. And we flip it upside down, we go a little bit more. Now we're going to smack the bottom here. Sorry, rather, we're going to put the cap on first and then smack it. Getting rid of the air bubbles, bring the air bubbles to the top. Once we're finished that, we are going to bring the liquid to the top of the cap, the syringe rather. Once we are there, we're going to put the stopper right to our 10 milliliter mark. Fantastic. And the syringe is finished. Now we're going to create our label for it. Once again, Miss Dayen is the patient. Drug name, acetaminophen. The dose is 500 milligrams. The volume is 10 milliliters. And then concentration per milliliters is 250 milligrams per 5 milliliters. Date is December 16th. Once again, 1652. Signature, UMSN. So previously we already compared the containers to the MAR, so now we're going to compare the labels to the MAR and the containers. Right after I put this label. Okay, so here we go. Compare to the MAR. So, Miss Dayen, correct patient. Ibuprofen, right drug. 200 milligram is the dose, yes. Right time, yes, it's at supper time, that's what we want. Right route, yes. Fantastic, okay, we got that one's correct. And then, yeah, we already checked actually we gotta check the label as well, so ibuprofen, 200 milligrams, 1 tablet, yes. Okay, that was good. Then we're gonna check warfarin, check it with the container first, why not? So 1 milligram is 1 tablet, so we got 2 milligrams. That's correct. Warfarin, right drug, yes. And then we're gonna check to the MAR. Warfarin, yeah, right drug. Miss Dayen, correct patient. 2 milligrams, that is correct dose. Right route, this is gonna be oral. And correct time. Supper time, perfect. All right, that one's good too. And lastly, acetaminophen. Miss Dayen, correct patient. Acetaminophen, right drug, 500 milligrams, that's correct dose. Right route, yes, the liquid suspension is going to be oral as well. And right time. Okay. So, now that we've done the correct second check and first check, and we've created our drugs, we are now going to go to the table. Before we go to the table, we have to make sure that we have everything that we need. So, do I have all the drugs I need? Yes. Because these are oral tablets and oral liquid suspension, we are going to bring some water with us. It'll help the patient get the medication. So, for the purpose of this demo, I'm going to pretend there's a sink here, getting water. Before I do that, we put back the containers where they need to go. So let's pretend this is a medicine cabinet of some kind. Okay. So, we bring our drugs, we bring our medication, we bring our MAR, and we bring the water, our pen, and everything. So as we walk in, we knock on the door, we say hello. My name is Jeremy Rogge. I'm going to be your student nurse today. We're administering some drugs for you. As I walk in, I'm doing a general survey, making sure that it's safe, making sure the patient is safe. I look at their color, look at their level of consciousness. Are they awake? Are they answering my questions? Things like that, making sure the patient is safe. So, to work with them, I'm going to raise the bed up to my hip height. Otherwise, this will hurt me. Okay. All right. As I talk to the patient, I'm saying, hello. What is your name? Miss Dayen, it matches up. What is your birthday? July 10th matches up. Who's your doctor? Perfect. And then what is your allergies? Fantastic. Is there anything else, or do you have any other allergies? I know they don't have any other allergies, so we're good. So we're going to bring the drugs here with our water, with our drug cards. So before we administer the drugs, we are going to do our final third check. So we're comparing the MAR to the labels. So ibuprofen, right drug, yes. 200 milligrams, right dose, yes. Right route, yes, we're giving tablets. This is going to be given orally. Right time, once again, yes. You're supposed to give it at 5 o'clock. It's approaching that time quickly. All right. Next, we're going to do warfarin. Warfarin, right drug, yes. 2 milligrams, right dose, yes. Right route, yes, we're giving tablets. Once again, PO. Right time, yes. And right reason, yes. Okay. And lastly, acetaminophen, right drug, yes. Right patient, we already gone over that, yes. Right dose, yes, 500 milligrams, we're giving 10 milliliter suspension. Right time, yes, once again, 5 o'clock is when we're supposed to administer. It is 5 minutes too, so we're doing good. First, I'm going to educate the patient a little bit about the drugs that they're about to take. So acetaminophen, it's a pain reliever. You're supposed to feel relief of pain. Have you taken other medications like acetaminophen, Tylenol, or as you might know it? They say no, so we're good to give the drug. Some implications for myself, some side effects I need to look for. We're going to look for nausea. I'm going to look for abdominal pain. I'm going to come back over and make sure that they're not in any pain from it. And we're going to check for liver poisoning as well. So here we go. Acetaminophen. Before I administer, we're going to raise the head of the bed to around a 90-degree angle, or rather a bit less than 90 degree. Because the patient is taking the drugs orally, this is going to help them actually take it in. A lot of the time when you're giving medications orally, they have trouble swallowing it. So here we go. Acetaminophen. Squeeze it into the mouth. And then if they need some water to wash it down, here you are. We ask the patient first. Okay. So that one is finished. Next, we're going to give warfarin. This is warfarin. It's an anticoagulant. You're taking it to reduce your hypertension. It's going to help. No, not hypertension. Sorry. It's going to help in heart attack victims. People who have, Okay, some things that we need to look for is bleeding. We're going to look in your stool if there's any kind of blood in there. That is a problem. We don't want that to happen. We're giving a 2 milligram dose, which is perfectly in the safe range. We're going to come back later and check on you. Okay. So there's your warfarin, and we give the patient some water as well. Here's your water. Lastly, ibuprofen. What does ibuprofen do? It's a pain reliever. You take it, it's also an anti-inflammatory. So the dose that we're giving is 200 milligrams. It's 1 tablet. That is perfectly in safe range. We're going to come back later and we're going to check your stool again because GI bleeding or gastro is a serious common concern. All right, and here you are. Here's your ibuprofen and your water. So now that we've done that, we ask the patient, do you need anything else from me? Do you have any questions for me? No. If not, there's your call bell over there if you need any help. We're going to keep you in the seated position for 30 minutes so that the drugs can take effect. And I will be back in 30 minutes to check up on you, okay? Fantastic. As I walk out, I'm bringing the MAR, I'm bringing all of my dirty things. I'm checking around to see that everything is safe. I'm going to lower the bed. We don't need it that high anymore. And yeah, once again, checking everything is good. No water spilled, no drugs spilled, and the patient is safe. Fantastic. Dunzo.